So whenever the patient has an AKI, okay, it's an acute issue, something that happens in the framework of 1 week. Okay, that's why it's written 7 days. Okay, an acute kidney injury occurs. Now, the acute kidney injury can either become okay, okay, there can be an adaptive repair, or there can be a maladaptive repair. Whenever there's a maladaptive repair, it leads to CKD. Okay, it leads to CKD, as you can see in this diagram. Whenever there's a maladaptive repair, there's a uh, incidence of chronic kidney disease. Okay, sometimes there's a recovery. Okay, there's a sustained reversal. Then the patient is lucky enough. Okay, and whenever the persistence of renal dysfunction exceeds 90 days, that is 3 months, then you have it defined as CKD. Whenever the kidney dysfunction lasts more than 90 days, you call it chronic kidney disease. So what about the in between? What about the in between time? 7 days to 90 days. So that is what is newly coined as the acute kidney disease. So that's a new terminology. So when everybody started discussing, they understood that AKI is something that happens within 7 days in 1 week. And then CKD is the persistence of such a dysfunction for more than 90 days. Okay, so what about the interval period? So they coined a new term, acute kidney disease. Okay, which is the kidney dysfunction that lasts from 7 days to 90 days. So it can either go behind and become okay, or it can become a CKD. Okay, in the meanwhile, the patient can have persistent AKI, the patient can die, the patient can have recurrent AKI. So all these things can occur. Okay, ultimately, whether the AKI resolves, reverses, and the kidney function becomes normal, or is there a chronic kidney disease is the point.